5 Important Things to Know About Dehydration. Hello, welcome to JTC Health. Please like and subscribe to my channel and also click on the bell icon. Today I will be showing you 5 important things to know about dehydration. Dehydration is the absence of a sufficient amount of water in your body. Not everyone realizes dehydration isn't as simple as being extra thirsty. There's a specific dehydration definition, when your body doesn't have as much fluid as it needs to survive. Dehydration symptoms appear late. Sometimes people won't even feel thirsty until they are already very dehydrated. In severe cases, dehydration is life-threatening and requires immediate medical care. Here's what you need to know about dehydration to avoid the problem, or at least recognize dehydration symptoms so you can take the right course of action. 1. Dehydration symptoms and signs are different in infants and adults. Dehydration can occur to anyone at any age, so it's important to recognize the signs of dehydration, especially because symptoms vary depending on the person's age. In babies and very young children, you first may notice sunken eyes or a sunken soft spot on the top of the head. You may not have changed a wet diaper in 3 or more hours. The baby may not have tears when crying and may be irritable or lethargic. Adults may experience extreme thirst, fatigue, headache and, in severe cases, dizziness or confusion. The person often will urinate less often, and the urine will be much darker than usual. 2. Dehydration causes and risk factors are easy to overlook. Anyone who doesn't drink enough water, especially during hot weather or while exercising, is at risk for dehydration. In addition, dehydration can be caused by loss of fluids due to severe diarrhea and vomiting, particularly in young children, who are most likely to become dehydrated. In older people, a lung or bladder infection can cause dehydration. Adults may also have other diseases, such as uncontrolled diabetes, or take certain medications to treat other health conditions that cause them to urinate more frequently, raising their risk of becoming dehydrated if they don't make up for it by drinking extra water. 3. Dehydration effects can be fatal. While dehydration may not seem like a big deal, it can have severe complications. Among them include hypovolemic shock, which is a serious and potentially life-threatening condition. It happens when low blood volume from dehydration causes a drop in blood pressure and oxygen in the bloodstream throughout the body. If you're working or exercising outdoors and not drinking enough fluids, you could end up with heat cramps, heat exhaustion, or even heat stroke, which is another life-threatening condition. Other effects of dehydration include loss of consciousness and seizures. If you become dehydrated frequently, you're at risk for urinary tract infections, kidney stones, and possibly even kidney failure. 4. Dehydration treatment is simple in the early stages. To treat dehydration, you must replace lost fluids as well as electrolytes in the blood, particularly sodium and potassium. If the case is mild, just drinking more water may clear up the problem. In moderate to severe cases, you'll need to replace electrolytes as well. An oral rehydration solution may be necessary in these situations. Dehydration treatment may require an intravenous oral rehydration solution. Other options include clear soda or broth, ice pops, gelatin, or diluted juice. Plain water and sports drinks aren't as effective at treating dehydration because they don't have enough sodium and won't replace electrolytes effectively. 5. Planning ahead helps prevent dehydration. Besides drinking fluids, there are other things you can do to ensure you don't become hydrated, such as eating foods with high water content, think fruits and veggies. If you're in overall good health, you can typically just drink when you're thirsty to keep up with your daily water needs. Make sure you're getting 2 to 3 liters every day. 1 liter is about 1 quart. During hot weather or if you have a strenuous exercise routine, be sure to drink extra water as you sweat. If you're in a colder climate, you may need extra hydration to make up for the dry air. And of course, if you're sick, especially with severe diarrhea or vomiting, but also with minor illnesses, take a proactive approach by drinking extra fluids to prevent possible dehydration. Thanks for stopping by. Please subscribe, comment and share, and also give us a thumbs up. You have a remarkable day and week ahead.